Hello, dear friends and colleagues. This is Rakesh Jain, and I am delighted to present to you rather briefly on a topic of great importance, which is ADHD, particularly adult ADHD. And for us to be reminded that it is indeed a 24 hours per day disorder. It's not a disorder that takes breaks. So let's jump right into it. The notion is earlier in its career, so to speak, in the 1950s and 60s, when ADHD was beginning to be recognized, the thought was it was only a disorder of school time. So it was really 8 to 3, and it didn't affect the individual too much after that. Well, that was a myth, is a myth. ADHD indeed is a 24 hours per day disorder and can be severely impactful, not just at school or in the work setting, but also outside it. I'm looking forward to telling you a little bit more about that. So first things first, let's be quite aware that the symptoms and functional impairment in ADHD do change across the lifetime to the outsider's eye. But on the inside, the difficulties with inattentiveness and hyperactivity and impulsivity can be very problematic. So look at this. In the preschool era of a human being, it's primarily behavioral disturbances. But by the time they get to school age, we not only have behavioral challenges, but academic difficulties, poor peer relationships, self-esteem issues. And then by the time adolescence comes around, not only do all these difficulties continue, but in particular self-esteem and legal issues, even increased smoking and injuries step into the picture. And by the time these kids, if they're not diagnosed correctly or treated well, now academic failure, not just difficulties, falling out of school, leaving school, occupational difficulties if they're looking for work, self-esteem issues in both men and women, substance misuse, including food, by the way, injuries, accidents. And I really do worry about adults with undiagnosed, untreated ADHD, because now the consequences of a lifetime of untreated ADHD really come to the fore. And now we have all kinds of difficulties. It could be marital difficulties, it could be child-rearing difficulties, definitely occupational challenges and psychosocial issues. So this is a pretty devastating picture that I'm showing you of what does happen routinely in individuals who have not been accurately diagnosed or treated when they are in fact suffering from ADHD. But is this really a 24-hour disease? And as you examine this slide, this illustration we created many years ago, and it has stood the test of time, because this 24-hour clock perfectly describes really well the plight of the human being who has ADHD, particularly if they're adults. Well, when they wake up, they're often sluggish. They can't organize themselves, leave alone organize their children. Therefore, there are arguments in the morning and a day starts off wrong. Then they rush because they're impulsive and they're running late. They don't drive carefully. They get to work and they're disorganized. They're often hyperactive. They're often impulsive. Co-workers notice that. Bosses notice that. The work is not done well. They drive home erratically. They're not very patient with their children at home. They have difficulty interacting with their spouses, balancing their checkbooks, planning logistics for next day. Everything is done kind of at the very last minute. They have trouble going to bed on time. They sleep fitfully. They don't wake up soundly. So this challenge of a 24-hour per day is not an urban myth. This is the classical, typical presentation of adult ADHD across the country. So please be quite clear about this, that ADHD is simply not just a disorder during work hours or school hours or college hours. It really truly is a 24 hours per day disorder, and that it affects all facets of human life. So, as an adult, you not only are dealing with your own life with yourself, but you have to interact with work or school or your social life. You might even be a parent. All of these things, ADHD can not just affect it, but affect it quite badly. So, I'm just one more time reminding you that it is incredibly wise for every clinician and every person who has an interest in ADHD to really examine the entirety of the day and not just focus on the school hours or the work hours, but how are things before work? How are things after work? How are things during weekends? How am I doing with not just the classic symptoms of ADHD, which are hyperactivity, impulsivity, and distractibility, but also things such as emotional regulation, behavioral regulation. How am I doing with that is a legitimate question to ask of oneself if ADHD is a challenge. Do you want to read up more on it? Knowing you, you probably do. So here's an article that is easily available by going to the web address I have posted here. It will be free. You would not have to pay for it. It is a PDF article of a pretty major review I and two other colleagues did, which was addressing the diagnostic and treatment gaps in adult patients with ADHD. Every illustration that I've shown you so far comes straight from it. I very much encourage you, no matter what your background is, if you're a student or if you are a mental health professional or you're a professional who just has a deep interest in adult ADHD, this is not just a very nice review of the topic, but it has a lot of illustrations in it to help make crucial and critical points that I really do hope end up helping hundreds of thousands of people who suffer from this condition. Okay, so I wanted to thank all of you for letting me briefly present a little bit of information on adult ADHD. And please know, over the next coming weeks, I will send you very brief quick video messages on different aspects of adult ADHD so that we can all together grow in our knowledge and expertise regarding this condition. This is Rakesh Jain thanking you for your time. Goodbye.